Welcome everyone to this online webinar organized by Scroll in collaboration with the Pulitzer Center. We are honored to have with us two very distinguished scientists, Dr. Soumya Swaminathan, the chairperson of the MS Swaminathan Research Foundation, who until very recently was the chief scientist of the World Health Organization. We all know her as a voice of calm and reason at the time of a global health emergency, the COVID-19 pandemic, which incidentally is connected to the theme of this webinar, the impact of climate change on health. Thank you, Dr. Swaminathan, for joining us. I'd also like to welcome Dr. Meghnath Dhimal, Chief Research Officer at the Nepal Health Research Council. Dr. Dhimal is an environmental health scientist who's been studying the impact of climate change on health in Nepal from many different dimensions. His research is extremely relevant to all of us because what happens in one part of South Asia doesn't stay there, it travels. Just the way Himalayan rivers originating in Nepal flow all the way into the Bay of Bengal, or toxic air floats above the fence borders between India and Pakistan. Thank you for joining us, Dr. Dhimal.
Thank you so much for the invitation.
We also have with us three journalists who've been doing outstanding reporting on the subject we're discussing today. Jesmin, Papri, an independent journalist from Bangladesh. Mahima Jain, an independent journalist from India, who's currently in Denmark, where she's pursuing a climate journalism fellowship at the Constructive Institute. And my colleague, Tabassum Barnagarwala, who covers health for Scroll. Thank you all for being here. Before we begin the discussion, I'd like to briefly hand over to Susan Ferris, Senior Editor at the Pulitzer Center, who proposed the idea of this webinar. Thank you, Susan, for initiating this. Do share your thoughts on why you felt we should talk about climate and health.
Thank you so much, and welcome everybody to this webinar. Thank you to Scroll for hosting it and co-sponsoring it with us. Scroll does excellent work. So we're very happy to collaborate with this outlet. And welcome, everyone. Pulitzer Center supports reporting around the world, and we're especially interested in certain subjects like climate change and global health care. Global health care means whatever's going on in your country, how your health systems are working. Are they prepared for the crises that we're going to be seeing and we've already seen? What is your country doing to collaborate with others? What kind of research is going on, etc. I invite you all to look at our website, pulitzercenter.org, and you can get a sense of all the different types of stories that we are supporting. We support ambitious projects with funding, and also we can provide advice. Many of us are journalists, and we have years of experience reporting. So I wanted to let you know, too, that there's another webinar coming up that you might want to tune into from the United States, from Denver, Colorado. It's the American Association for the Advancement of Science. And you can see an event listing on our website for it. There is Science Magazine in the United States, an entire issue about health and health threats and climate change, especially heat. So I'd like a special nod to Mahima, who was one of our grantees, and she can talk about her work today. I'm sure that we helped support. Thank you so much.
Thank you, Susan. We'll be sharing the link to the webinar that Susan spoke about. It will be there in the comment box. A quick note for the audience, many of you might have questions for our panel. Please leave them in the comment section. We'll try to take as many of them. I'd like to start with Dr. Swaminathan. Dr. Swaminathan, I recently heard your excellent lecture on the subject of climate change and health, the C.D. Deshmukh Memorial Lecture, which was packed with many, many insights. I've taken the liberty of pulling out a few data points from your lecture, which are quite stark. You pointed out 2023 was the warmest year on record, with record ice melt and a record rise sea water levels. Global temperatures are likely to rise by 5 to 4% by 2100. And if global temperatures rise by 2% by the mid century, heat related deaths are expected to increase by 370%. Over 500 million people are likely to experience moderate to severe food insecurity. Transmission potential for dengue is projected to go up by 37%. You also shared data for India, which points to trends that are quite likely true for the larger South Asian region. Extreme weather events killed nearly 3,000 people in India last year. 75% of districts in India are extreme event hotspots, vulnerable to cyclones, floods, droughts. And 17 of 20 people are vulnerable to hydromet disasters. Now, heat waves, forest fires, floods, cyclones, other natural disasters that we're seeing are the most visible impacts of climate change. Dr. Swaminathan, I wanted to start by asking you what are the impacts that are less visible and how can we do better as journalists to identify and to cover them?
Thank you, Supriya, and thanks to. I'm getting an echo. Is it okay? My voice is clear? All right.
Yes, we can hear you.
Thanks to Scroll and the Pulitzer Center. It's a really important topic and it's very close to my heart. And I think that the media, journalists obviously play a very important role in highlighting issues, to the public, but also to policymakers. And especially, as you said, maybe some things which are not so obvious. Now, you put some statistics out there. There are many more statistics. I mean, 2023 is the hottest year in record. We've already crossed the 1.5 degrees. Of course, according to the IPCC, the 1 year, crossing the 1.5 degrees doesn't mean that we've actually crossed over that tipping point. We have to see subsequent years what happens. But the fact that the whole year the average temperature has crossed is extremely worrying. And the Paris goals were to keep the rise from going above 1.5. And I think the world is going to struggle to meet the Paris goals. And people are now hoping that we can keep it under 2, because for every subsequent rise in temperature, the effects are just going to be very devastating. Now, we also saw 2023, the year of so many acute events. And it's estimated that 85% of the days in India last year, there was an acute event happening, acute weather event in one part of the country or the other. So that means practically throughout the year, some part of the country was experiencing either a flood or a cyclone or a drought or torrential rain or severe heat. Now, I think if we can look at the impacts of climate change and global warming, I like to think of it as direct and indirect impacts. The direct impacts are things like prolonged heat waves, are things like these acute weather events, obviously the floods, the cyclones, and also, when you have like water-related illnesses and things like that. I think the indirect effects are more subtle. They occur, I think, over a longer period of time, and therefore you don't have like one day's emergency when, in fact, the Disaster Management Authority also mainly considers things as disasters, when they are sudden events. But when things happen over a period of time, for example, the sea warming, and what that's doing to the entire coastal ecosystem, what it's doing to marine life, of course, but also things like the algal blooms. The algae are able to flourish along the coast, and these are toxic algae, and they give off toxins. So that again affects both animals and humans that live on the coast, and cholera becomes much more frequent when you get these algal blooms. Similarly, I think the impact on food and nutrition security through the impact on water, on unseasonal, heat and rain and drought damaging crops could lead, of course, to drought, but could also lead to more subtle changes in the nutritional properties of the crops that then affect both human and animal nutrition. We also know that vector-borne diseases are influenced by changing climate. In fact, now you find mosquitoes that are responsible for dengue and malaria. You find them in areas where they previously could not live because it was too cold, elevation was too high. Now they're thriving. In fact, dengue is the fastest spreading infectious disease globally because the mosquito Aedes aegypti and albopictus have adapted so well to our urban and semi-urban environments. But again, the most subtle and the less talked about impacts, I think, are through indirect effects like impact on livelihood leading to migration and displacement, and impact on mental health because of either chronic or repeated stress. So there are populations, for example, that now experience this on a cyclical basis. The events, these are, let's say, people who are living along the banks of rivers that run through our cities. We find many people that live along, and last year we saw the Jamuna was flooded, Chennai, the rivers were flooded. It's these people who are living in shacks along the edges of the rivers because they don't have better places to live. Our first are the ones that get most impacted. Similarly, I think people who are outdoor workers, who are daily wage workers, who live in housing where there's very little ventilation and protection from the heat, or in fact from the extreme cold, if you're talking about North India, would be the ones to suffer the impacts. And also, I think many of these things work in synergies. For example, now there's data showing that if you're exposed to both extreme heat and air pollution, or heat with humidity, then the impact on your cardiovascular system is much worse than being exposed to any one of those two alone. So again, parts of South Asia will have exposure to both high heat and humidity, and other parts to high heat and air pollution. And finally, mental health, which I mentioned earlier, but mental health both of people who have had exposure to sudden acute weather events, like a post cyclone, they're displaced, and then for a prolonged period, their child is out of school, their livelihood is disrupted, and their mental health impacts have been documented in the short term, but there have been no longer term studies. And similarly, I think for people whose whole lives are being impacted, there's chronic stress. For example, fisher communities, we work with them, and SSRF works with them. They are finding that they're no longer able to predict whether they can make a living or not out of their traditional occupation of fishing, because it's become very uncertain. The number of days that they are having to stay out at sea is increased in order to catch the same yield. The quality of the produce is not so good. And so there's that uncertainty and stress both among men and women. And there's a gendered, I think, some meta-analyses and systematic reviews have shown that women are disproportionately impacted because they're also responsible for water, for food of their households. So anything that disrupts that, and for caregiving, obviously, of the children and the elderly, and therefore the burden on them increases. So we need to also look at the impact on women, but how gender sensitive are our policies, and how can we really adapt in a way that's not causing more harm to certain groups of people. So overall, I would say climate change impacts everyone, all of us, but I think in very different ways. And so even, for example, saying that all women are disproportionately impacted is not true. So if you look at the intersectionalities of caste, of religion, of gender, most importantly of socioeconomic circumstance, that really impacts your ability to be able to protect yourself from what is otherwise, a global phenomenon. And at the global level, yes, there's the inequity between countries, and so we're seeing populations that are contributed the least to global warming suffering the worst impacts. But within countries, within states, within districts, and within cities, it's not uniform as well. And so there are certain very highly susceptible or vulnerable populations that would need special focus in order to protect them. So maybe I'll just stop there for now.
Right. I was in fact going to follow up by asking you about South Asia in particular, because it's not just geography. We are part of the tropical equatorial belt, which is climate vulnerable, but it's also our social demography, the fact that we are population dense countries with low social economic development. But you've in some ways already responded to that. But you also did mention, the larger question of climate equity at the global level. And there in your lecture, you pointed out that health became part of the agenda at climate talks only last year. It was the first time in the COP held in 2023 that there was a day carved out to talk about health. Why is this important, Dr. Swaminathan, and why should health journalists be paying attention to this? Because this was seen as the purview of those who cover climate and environment. But clearly, there's a reason now that as health journalists, we need to understand climate talks, right?
Yes. In fact, I find it really puzzling that health, in fact, agriculture as well, never featured prominently in the COP. Because I think if it had come up earlier as an issue, and this is what some of us have been saying for some time, and the WHO, of course, has been very strongly saying, at least for the last 5 years or so, that the climate change impact on human health is going to be so significant, and it's going to impact all of us and our productivity, and the economy is going to be impacted. All that is going to happen through health, and also it makes it very real and practical for people. So if you just talk about 1.5 degrees and 2 degrees, it doesn't really mean anything to a common person who's essentially thinking about their own lives and trying to live their lives. But if it starts percolating to the level where you think that I'm getting more sick, that I'm not able to go to work as I used to in the past, that my traditional occupation might completely fail, my children are missing so many days of school because of my medical expenses are going up because I'm getting ill more frequently, then I think that starts making a difference, and to the individual, but also I think to policymakers as well as to businesses. I mean, I'm really surprised that businesses are not thinking about the loss in productivity that they're going to see, and that health systems and ministries and departments of health are going to see an increased load and a burden, and so the expenses are going to increase. So there are many reasons why we need to think about health as a pathway to action on climate change, because I think we can bring the urgency. Yes, if the Arctic melts, we know there's going to be terrible consequences for that. But today, I can see what's happening, to the floods in Pakistan, for example, the forest fires that Indonesia faces, the kind of floods that we've had in India, as well as the unprecedented heat, because of which we've also had crop yields declining. These are immediate concerns and makes everybody sit up and says it's happening in the here and now. So I'm hoping that at least now with health, with the declaration on health, with the recognition, I think that it's going to be, and Director General of Tedros, Dr. Tedros of WHO has been saying that, it needs not only to be an integral part of climate talks, but it really needs to be where the action should happen right away. Right. And I think the development banks, for example, the kind of infrastructure loans and grants that they give, you can have they could have a significant impact by ensuring that that infrastructure is going to increase the resilience and not further add to the problems that we're already seeing.
Dr. Swaminathan, if I may bring up a subject that most of us now avoid, perhaps because we are still traumatized by the last one, the pandemic. In the lecture, you said that pandemics are going to become more frequent because we're destroying forests and increasing the possibility of viruses jumping from one species to the other. How can we track this better as researchers and journalists?
Yeah, so that's a a really good question. And I think there's no, there's no one, I think, data point that one can track that will tell us. And of course, there's no way exactly of predicting where and when the next pandemic is going to begin. But if you look at the last 50 odd years, we've seen zoonotic viruses jumping from animal to human species more frequently than probably we've seen in previous centuries. And in fact, coronavirus itself in the last 25 years, we've had three coronaviruses jumping from animals into humans and causing quite severe disease. The SARS-CoV-2 was probably the worst in terms of the impact it's had on the world. But we know that influenza as a threat has always been considered to be a pandemic threat. The last pandemic, H1N1 2009, turned out to be a mild form, so we were, I think, lucky. But at any time, you could get an influenza strain. And similarly, there are at least 25, 26 other families of viruses that some of those viruses are seen in humans already, and then there are others which are circulating in animals, which are very closely linked to some human disease that could actually mutate and become pathogenic to humans. And at the same time, like I said earlier, the vectors are also changing their behavior. So whether they are mites or lice or mosquitoes, they also are changing their behavior. They're adapting to the climate and they're coming out of their normal habitats. So scrub typhus used to be seen only among people who go into the forest or who are working in fields, but now in urban areas you see scrub typhus. Personal forest disease, hemorrhagic fevers, they all keep popping up from time to time. So it's a huge tens of thousands or hundreds of thousands of viral species that potentially could cause disease in humans. So one thing is, I think, understanding, and this is sometimes referred to as One Health and so on, like we really don't have a clue as to the viruses that are out there and which ones are more, and we can't track every virus that there is in the world. So the WHO is putting together a list of priority pathogens, which according to experts would be most likely from which the next epidemic or pandemic could come. So I think countries would have something to go by and set up surveillance systems to be able to track not just in humans, but also in animals, set up sentinel surveillance sites, perhaps people who are most exposed, maybe those who go into the forest, those who come into contact with both wildlife and domesticated animals. So there could be sentinel surveillance sites that are constantly monitoring, collecting data, but also disease sentinel surveillance monitoring, like we do for acute respiratory illnesses. And there needs to be a system of very quickly being able to share that data, analyze. So I think this part, I think everyone recognizes that the animal, human, veterinary, and wildlife sectors need to come together and share much more and talk to each other. So that is one. The second is the whole ability and capacity to investigate events. So in some remote village, if you have something happening, the local healthcare workers, the local community should be able to recognize early on, and the district authorities must be immediately capable of going there, doing an investigation, doing the right kind, getting the right samples, sending them to the lab and acting on them. For example, even a few months ago, we had an anthrax outbreak in Koraput district of Orissa, and unfortunately, a couple of people had died before anthrax was found to be the cause, even though cattle were getting sick and dying and so on. And there are some cultural practices there that might promote this from happening. Similarly, we've had many outbreaks in the past. I think where India is now really trying to strengthen its capacity to do this type. District epidemiologists are being boosted. So you need at the district level at least people with the capacity, a team to go quickly investigate, because we can't prevent a zoonotic event from happening. That is nature, and we won't be able to stop it. We should be able to identify and stop something from becoming an epidemic and from becoming a pandemic. That's the goal, should be, like Kerala did for Nepal. They identified immediately after the first case, and then you got no further cases. This was in the latest outbreak. So I think that has to be the goal of the public health authorities. And ultimately, yes, and then we have to take action, of course, in the prevention side, which is let's stop destroying biodiversity, let's stop going into pristine forests and cutting them down and building things, because all of these just increase then the chances of interaction. And there's the illegal trade in wildlife, that's another route through which animals go from one habitat to completely different country and then get exposed there to people. And in fact, the
Right.
wet markets in China, considered very high risk for this type of viruses crossing one species to another to happen. So they've been banned, but there's
Right.
still the illegal trade in wildlife, that that happens. So I think some of those predispose to risks of pandemic. So we need to also act on those risks, but then also prepare the system to respond appropriately.
Right. Thank you, Dr. Swaminathan. I'll come back to you. There are many more questions, but you spoke of
Sure.
One Health, understanding that human health is intimately connected with the health of the environment. Dr. Dhimal is here. He's an environmental health scientist. Dr. Dhimal, if I may start with a slightly informal question. As an environmental health scientist, you find people asking you, what exactly do you study, the health of the environment or the impact of environment on health, or both, since they are interconnected?
Thank you so much for a very nice questions, and many thanks to Professor Soumya for highlighting the issue of One Health, planetary health. Yes, as a human being, if you count especially in the low and middle income country, almost 80% disease burden is linked with the environmental risk factors. South Asia, Nepal, or India, majority of diseases are linked with the air pollutions, like water pollutions and different heavy metals. Now, microplastic is also emerging issue. So we need to make ecological balance so that we can achieve our health. So we need to talk human health, animal health, and uh, overall, planetary health. So the concept of One Health or the planetary health came. So now we are facing the triple challenges. We see the planetary crisis, that is triple planetary crisis. One is the pollutions, next is climate change, and next is the loss of biodiversity. Just Professor Soumya mentioned about the spillover effect. Like many diseases are genetic in origins, including COVID-19 and others, right? So if we distort our ecology, means none of the living being can exist. Like WHO Director General Tedros clearly mentioned that no one is safe until everyone is safe, right? So today we have a vaccine of COVID, so we all can see each other. Otherwise, might be the will be in the face mask, right? So for the sustainable planet and to live, healthy, we need the ecological balance. For that, we need to maintain a planetary health or one health. Then only we can go together. Otherwise, may we get some benefit for the human welfare, but we may not go longer. That's the basic concept from the, let's say, environmental health science perspective.
Right. Dr. Dhimal, you're in Nepal, which is part of the broader Himalayan region. It's an ecologically
Yes.
fragile region. What are you seeing as the main health risk posed by climate change in your country?
Thank you. Yes, we all know that Nepal is a mountainous country and very famous for mountaineering, right? And which is located in the central Himalaya, let's say Hindu Kush Himalaya region, which extends from Afghanistan to Myanmar. And if you see the global pattern, mean the warming rate is highest in the Himalayan regions compared to the rest part of the world. As a result, there are the several direct and indirect impact of climate change on human health. Some of the direct impact includes like heat waves, floods, storms, hurricanes, like injuries, and so many others. And also indirect impact through the change in ecosystems. For example, vector-borne disease, waterborne disease, and like mental health, non-communicable disease, Now we are talking about the reproductive, sexual health. These all are affected by the climate change. Unfortunately, unfortunately, we have a very limited evidence from this global south because there is ecological crisis. That means, let's say, ethical crisis. Most of the emission come from the global north, and most of the burden of the climate sensitive disease in the global south. Again, most of the publication again come from the global north, but global south have a very few publication, right? So we don't know the exact impact of the climate change in the global south, including Nepal, India, Pakistan, and any country. But at least we have started. So the study in Nepal has clearly shown that the distribution of the vector-borne disease has clearly changed the geography from the lowland tropical to the even temperate alpine regions. So we had a first case of the dengue in 2004, which was imported case. First outbreak in 2006, bordering India, bordering district in the southern Nepal, the India. But now we have more than 50,000 cases every year, more than 100 of deaths, and most of the cases come from the hill and mountain regions. Same goes for malaria. Same goes for the scab typhus. Similarly for the visceral leishmaniasis. And this is not a case of only Nepal. All countries located in the Hindu Kush Himalaya regions, right? So there is a clear pattern of the change in the spatial pattern of this vector-borne disease as well as temporal pattern. Means these diseases were seasonal in the past, let's say in the monsoon season or post-monsoon season, but now they are perennial. We can see throughout the country at least up to 2000 meter, right? So there is a clear change in the epidemiology of this vector-borne disease. Same goes for the waterborne disease. Still we have an outbreak of the cholera, outbreak of the diarrheal cases, and these are seen mostly in the hill and mountain regions, right? So there is impact in the waterborne disease. Similarly, in the foodborne disease, we can see that several epidemic of the food poisoning cases, right? Also in the hill and mountain regions. And there are impact on the non-communicable disease due to the long exposure to the high heat, like the chronic kidney disease, cardiovascular disease. And we can also see the impact on the reproductive and sexual health, right? Even there is an impact on the early marriage, right, and the newborn, fetus, right? So many impacts, right? So these impact are now just we are digging out, and but still we need to define the exact magnitude of the problem based on the evidences. So that is still remaining. But I just can say right now that there is a clear impact of climate change on the infectious disease in this region, but for the mental health and the NCG, we need to work further. Just one example I want to give for the mental health. Let's say in India or the Nepal, they are the we are the agricultural country, right? And many farmer depends on the rainfall, right? Because there is no proper irrigations, and if there is a long-term drought, many farmer attempt suicide because they cannot pay the loan, right? They cannot maintain their livelihoods, right? So though already there is a high rate of suicide or the mental health problem, but the climate change will exaggerate these problems, right? So we can see the several impacts, and I think it may be a too short time to discuss everyone, but I'll be happy to answer the question later or your queries, please.
Yes, we have several questions, but there's just one thing that you said, which I wanted to bring up. You said that there aren't enough scientific papers being published out of the global south. And as journalists, that's a problem that we often run into, where there isn't enough robust scientific data available to write about, for instance, the
Yes.
outbreak of infectious diseases, how that's connected to climate change. At Scroll, we published a story on scrub typhus, and I remember the process of reporting that story was challenging because we were looking for robust data. Any advice on how journalists can navigate this sort of paucity of data that we have in South Asia?
That's very true. So even like 10, 15 years back, even if a scientist talk about impact of climate change on, let's say, malaria or the dengue, the people said, yes, he's a mad person. How the mosquito can survive in the high altitude or something, right? So even for me, till 2010, that was a challenge. That's motivated me to pursue my PhD on climate change and vector-borne disease in Nepal, right? So that's true. But now there are so many emerging findings coming up from the global south. If you see the latest report of Intergovernmental Panel on Climate Change 2022, many case study has come from Nepal, India, Pakistan, right? Global South. Even many others are increasing from the global South. So that's a good, I'll say, signals, right? And many students of even university and national government are doing also some small scale studies, and they are publishing as a report or national journal or international journals, right? So I think there are now some evidence coming up, but yes, there may be very limited evidences, and we need to think globally but act locally, right? So my suggestion is that yes, we can get any information from the global literature or the regional literature, but to validate that in the local context, we need to validate with the experts of that region, or for me the the rich knowledge with the indigenous people, local communities, we can take interview with them. So based on the empirical finding, experience of the people, I think journalists can make a very lovely story. So that will really touch the heart of the many people, and we can highlight the issue. For me, I can't wait, let's say 30 years, 40 years to get a longitudinal robust data and to report, okay, we have an impact. For me, like
Yes.
single case of the dengue in the high Himalaya is a great signal of the impact of climate change for the preparedness of the health system. Please.
Yeah. Thank you, Dr. Dhimal. As journalists, we often say our job is to write the first draft of history, but perhaps our job is also to write the first draft of science by reporting on local outbreaks, which may not have yet been noticed by
Yes.
the sort of scientific community. At this point, let me just bring in the journalists. Well, again, this is a very sweeping topic, and there are many different things to talk about, but maybe we should start with the most visible impact we're seeing in South Asia, which is rising heat. Tabassum, if I may start with you, you reported last year on a heat tragedy in Maharashtra on the western coast of India. 13 people died of heat stroke while they were attending a political meeting in peak summer. I remember a chilling quote in your story. A forensic expert who did the autopsies of the dead said their kidney, liver, lungs, and brains had shrunk because of sun exposure for 6 to 7 hours. Tell us what you found. Were these deaths officially counted as heat related deaths? Why were local authorities unable to prevent this tragedy? And what did you learn in the process of reporting this story that could be useful to other journalists listening in?
Sure. So when I began reporting on this story, there were 13 deaths initially and then 14 deaths eventually because of heat stroke. They were recorded officially as heat stroke deaths. But initially for us reporters to get confirmation whether this is a heat related death was very difficult. The simple reason being that the venue where this event was held in Kharghar, Navi Mumbai, did not have its own dedicated recording station. So there was no temperature recording that could be done there. The closest station was 20 kilometers away, which recorded a temperature of 38 degrees, the highest for that day. And I spoke with disaster management officials, and initially they said that anything beyond 40 is when the alarm bells start ringing. 38 degrees is not really a high temperature to relate the temperature and heat with deaths. But what I realized while I began talking with a lot of experts was that 38 degrees coupled with high humidity could be a recipe for disaster if people are made to sit under sun for 7 to 8 hours without constant hydration and food. This is exactly what happened in Kharghar event. This was a political event which began where people began gathering early in the morning and they stayed till afternoon. They were under harsh sun, 38 degrees, no shade, less water, and there was high humidity. High humidity does not allow your sweat to sort of your body to sweat. It does not allow the body to cool. So the effects could be disastrous. In the post-mortem reports, we found that these organs like liver, as you mentioned, lung, the brain, and kidney had been damaged. So all the post-mortem reports actually suggested kidney failure and heat stroke as the final cause of death. As a journalist, what I realized was that it is very easy for the administration to sway you away from the real subject. Tell you that this was basically people who had comorbid conditions, who were elderly, who were vulnerable. Of course, they are more vulnerable, and for that same reason, this whole event could have been avoided. This was a combination of climate change and a man-made disaster, where the authorities should have actually not held that event that day. What I also realized while reporting that particular story was that India currently lacks uh, local protocol for establishing disasters or heat strokes. We sort of rely on a countrywide data or a statewide data where we say that 40 degrees would be the minimum threshold beyond which the temperatures will be considered risky for people to venture out. I think that needs to change. There now needs to be more localized data available for journalists and for the authorities to take decisions for such events. For journalists, I think what is important while reporting these kinds of stories is to just desperately, religiously, without any shame, chase IMD officials, the Indian Meteorological Department, and the environmental specialists. IMD officials, if you chase them, they will actually sit and explain to you, what this particular temperature would mean for this particular locality, which could be completely different from a temperature in, say, Rajasthan or Madhya Pradesh or in Pakistan or Bangladesh. The humidity, the wind speed also play a role. I think for us to report on these issues, it is also important to keep reading about how weather locally affects a particular region. Unless we do that, reporting on incidents like this becomes very difficult. So I think that was a learning takeaway that I had that day while I was reporting on this particular news.
Thanks. Absolutely. Local context matters. And as journalists, even if we are pursuing a beat, it's always good to know more about other beats. And I think for health journalists now, paying attention to environment and climate change is very much sort of part of pursuing their own beat. Um, well, Tabassum, you reported on heat deaths, which are the most direct impact of rising temperatures, but there are many invisible, indirect impacts like the stress on workers leading to lower productivity, lower wages, pushing them into poverty. Now, Mahima, you reported on this by visiting work sites under India's Rural Employment Guarantee Program. You looked at the question of whether social policy can build climate resilience. Mahima, tell us, what did you find?
Thank you, Supriya. So this is one of the stories that I did, looking at impact of heat on labor productivity. India has, Dr. Swaminathan mentioned that we have around 75% or 50% of 75% districts were impacted by extreme heat, are impacted by heat, and a lot of our GDP also comes from heat exposed labor. Apart from this, there was another story I did on fisheries, and again, she also mentioned how it impacts the entire supply chain and how workers are affected, and how the mental health of workers is affected because they are under chronic stress. So that's obviously one of the first impacts which farm workers and laborers under this scheme also face. But what I was specifically also looking at was, yes, we have these impacts impacts of heat on health, like what Tabassum mentioned, what Dr. Dhimal mentioned, but then what now and what next, right? And so one of the things I was looking at is the workfare schemes, our MG and Narega scheme, which provides 100 days of employment. And, the scheme provides 50 extra days in cases of disasters. But what I found was that this often kicks in only when there are water-based disasters, that is floods and, cyclones. For droughts, it takes a longer time to declare droughts, which means workers don't often get the extra 50 days. They desperately need to compensate for the loss of work. It also affects their productivity on sites. So when I asked the question of what next to different people, I had different answers. So experts would say things like, we need to bake in an anticipatory element where we predict droughts and heat exposed people who are going to be exposed to heat and kind of give them benefits in advance. Others said that, others labor unions and workers' rights activists would say that we need better shade, we need better protection for these workers, and we need to change working hours. And workers themselves would say things like, we need a bit of healthcare, we need something on site to take care of us, And so once I started asking those questions, I got different response. So I feel as journalists, one of the things we can also do is to find those questions where we are criticizing, but also asking what next and what now, so we can have more constructive elements which policymakers and people who are able to make a change can look at it and say, this is what people want and this is what we can do. So yeah.
That's a great insight, and we'll come back to this, Mahima. But again, I noticed your reporting focused on women workers because, again, a very large number of workers in India's job guarantee program are women. We also, Dr. Swaminathan mentioned that like not all women are equally vulnerable. That we need to pay attention to intersectionality. I'd like to bring in Jesmin Papri here, who's done a remarkable, eye-opening investigation looking at how rising seawater levels are impacting the reproductive health of women in Bangladesh. Papri, tell us how you got the idea of doing this story, how you went about reporting it, and what were the
Okay.
challenges you faced.
Yes, thank you. Thank you for inviting me here. Actually, yes, I have conducted multiple reports over recent years on the effects of climate change on women's health. You know that. And actually, I want to talk about it from how I started this report, doing this report. Actually, it was 2019, and I was getting ready to resume my work after giving birth my twins. So I went back to my small newsroom after a long gap and started looking for opportunities to explore something actually big, big and new, obviously. So I actually I want to grant re-entry into the media industry, which is largely male dominated, And I tried that time. I tried a MRDI fellowship. MRDI is very well known in Bangladesh, and I hope you know it. And actually, I got the chance, and I was supposed to work on paucity of pure drinking water in our coastal area. Okay. So, and in that time, I saw empathy on my mentor's eyes because I'm a new mother. But I knew that I would do something great. Actually, the coastal area is the region actually I belong to. It was my power. And then and you know that all the women in the coastal area, they're actually famous for their resilience. So that I went there, and I actually uh, started differently. I found plenty of stories on scarcity of pure drinking water, but very few or hardly any story about the how salinity is um, affecting the lives and livelihoods of our people, in particular women. So I started talking with the women. In the first few days, my project actually looked very messy. By then, I interviewed around 20 to 25 women, but actually, I guess they used to walk about 5 to 6 kilometers per day to face 1 or 2 pitchers of water, and they suffer from water-related diseases. It's very common thing. So I remember one woman lamenting. I can't remember the last time when I had a proper bath. Oh my God. It was
Right.
yeah. And another woman showed her just whole body
Sorry,
due to the
sorry, I'll just
salinity.
interrupt you, Papri. I think there's a little
Sorry.
bit of audio problem. We're missing
Oh,
some
oh,
of the
oh,
words you're
sorry.
saying, but
Sorry.
just for people listening in, Papri was describing how she started reporting from
Yes.
coastal Bangladesh. a region that she belongs to, and she started talking to women, and women said that because of not having enough fresh water, they have, like, a woman told her that she's not taken a bath. And that's, I think that's where you were, Papri. You want to pick up the thread from there?
Okay, okay. Are you listening
Yes,
clearly now?
yes,
Okay.
yes.
So at that time, another woman showed scars across her body due to the salinity. Actually, I feel that time that nobody loves these women as they have scars and skin diseases on their body. I saw multiple leads, but that time no conclusion. It was puzzling. They were puzzling me. It seemed they had many more stories to tell, but uh, then I decided to keep digging, and I also was discussing with my mentor, obviously. And in that time I met a person. Actually, she's a doctor in based in our coastal area. It was Endurance Hospital, Friendship Hospital. She was a doctor from that hospital, and I went to meet her. She kept me waiting as she was taking her patients. So at that time, actually, I could hear the fragrance of their conversation. Like she was telling her patient that don't take a bath in waste deep water. Stay bank of the
Don't
water
take
and
a
pour
bath in
from
waist deep
head to
water.
toe. Yes, yes, yes. Actually, as I'm from a village, it sounds weird. Why not the village people will go to bath for in the pond? So I waited till she was done with the patients, but the fragrance actually stayed in my head, and I rushed to the woman, that patient, and introduced myself. In Bangladesh, you know that it's a place where girls and women make a team and take a walk to collect water. Privacy is something very less care about. So the teen bride, she was or 18 years old maybe. Uh, she told me that she had suffering from problems relating uterus, and she gave me a new information that many women in coastal area had the same problem, and they wait the babies are born and then undergo hysterectomy. Okay, so that
Right.
was
I'll just repeat that
uh,
for those who are having trouble following you, Papri. What Papri is describing is how she met women at a doctor's clinic, and a young woman told her that she's having menstrual trouble, and that women are even going for hysterectomies. And all of this is
yeah,
because of, rising salinity of water,
yeah.
because of, the rise in sea water levels on the coast of Bangladesh.
Yes. So then I cross-checked with the doctor, and I got my story here. And actually, I was satisfied with all the evidence. But it was very hard to prove. Then anyway, then my story is now I got this story how salinity of water is affecting the reproductive health of our women. So the doctor, she was also very young. The doctor too was noticing the rising number of hysterectomy among the village women. She kept some records with her and shared with me for the well-being of the women, obviously.
Right.
So actually,
Yeah.
we were talking that nobody loves these women, neither they are men, and not the government even. These
Yes.
women are not in the public health records, though we have a fantastic health system on paper, in Bangladesh. We have
Yeah.
community clinics at the doorstep of the villagers. We have hospitals in the Upazila and district level, and the medical college hospitals in the almost half of the districts. So these women went to the private clinic and had their surgeries done by our government doctors, but
Right.
still they were not in the records.
Thank
So
you.
I decided,
Thank you,
and
Papri. I'm sorry, we're having, I think, some internet trouble and we aren't entirely able to follow. But I picked up most of what you're saying and I'll just summarize it for the audience. Papri was saying that they have an excellent health system on paper in Bangladesh, but there's a lot that is slipping through the cracks. And one of the things that was not being accounted for were the cases of women having reproductive health diseases, and that's something that she stumbled upon while reporting from coastal Bangladesh. She began to talk to women, and a doctor was particularly helpful because a doctor was maintaining records of the women who were showing up with the same pattern. In some cases, that was even leading to hysterectomies. The initially started as menstrual trouble, then reproductive problems, and many women just then decided to either, sort of get a hysterectomy or they started using contraceptive pills. That's actually quite a remarkable story of how journalists can play an important role in identifying, the impact of climate change on health grounds up, which is often missed by health systems. There's a lot, again, to talk about, but since both Dr. Swaminathan and Dr. Dhimal spoke about the outbreak that we are now seeing of mosquito-borne diseases, malaria, dengue, I'll just like to return to Tabassum, who reported on a massive dengue outbreak that we saw in India in 2021. The epicenter was the state of Uttar Pradesh. Tabassum, how hard was it to sort of get an understanding of the role that climate factors were playing in the outbreak?
So as journalists, health reporters specifically, we are used to covering outbreaks. There's nothing new in covering outbreaks. But in the last 2 years, a lot of health journalists will agree that we now need to also look at the climate and the weather angle whenever we are reporting any outbreak, because there's always a direct or an indirect relationship that the climate change will play a role. In case of dengue outbreak that happened in 2022, specifically in West Bengal and Uttar Pradesh, recording the maximum number of cases, we saw an unusually warm year. Of course, 2023 were warmer. 2022 was also, there were more number of days that were hot. And warmer climate sort of tends to have lead to a longer, more active mosquito cycle. In this case, Aedes aegypti, the mosquito responsible for spreading both Zika and dengue, was exploding in Uttar Pradesh. There's a combination of, again, administrative issues and climate change. The mosquito control exercise was not happening on time in Uttar Pradesh. They woke up really late to start looking for breeding spots and killing them, treating patients, which resulted into transmission from people to mosquitoes and then back to people. What I really thought was interesting to look at was, of course, climate change plays a role in outbreak, but we are also seeing multiple health impacts of this. For example, hospitals now have a longer waiting list for patients during peak season. So the season in this particular case outbreak was November, December, January, when hospitals were overflowing. They now have to arrange and accommodate for more patients, more beds for a longer period of time. The mosquito control exercise needs to begin well in advance. It usually begins by June before monsoons hit, but a lot of experts are now saying they need to start mosquito control exercise from March, even February, so that they're able to control the population by the time monsoons hit. What is also happening is a rise in out-of-pocket expenditure for health and treatment. A lot of patients who are not able to get treatment in government hospitals end up going to private doctors and clinics and spend a lot of money in testing, diagnostics, and medicines. This is all related with each other. The climate change, warmer temperatures are leading to outbreaks like Zika and dengue. We are seeing more and more Zika outbreaks within India. We've seen that from Mumbai, Pune. Uttar Pradesh was one example. That is also leading to more expense in diagnostics and test and treatment. In a lot of cases, children are missing out schools because of fever and chills. Women are not able to go out and work. Men are not able to they're missing out on their daily wages. So there's also economic impact which is happening, not just health impact. So these are also interesting stories that journalists can look for. we usually just report on the outbreak and then we forget about it. But then if we start now looking and relating different factors responsible behind the scene, the indirect factors responsible, I think there are a series of articles that are possible to do.
Right. Thanks, Tabassum. Now, the spread of dengue is a worldwide problem, as everybody has been saying. Mahima, you traveled to Colombia in South America, where scientists working with the World Mosquito Program are growing millions of Aedes aegypti mosquitoes in the lab in an effort to use them to counter the spread of dengue. Tell us about this program and what you found there.
Thank you, Supriya. So, just before I talk about the story itself, I want to build on something that was so important, very importantly, mentioned the fact that there are other stories beyond health and how health can be used. And that's also a space, especially she spoke about health expenses and stuff like that. And that is also a way to involve other industries and other sectors, and to talk about it to talk about health and climate impacts of health across different things. And here is where this story becomes interesting, because there's so much research that is being done on how do we tackle the climate crisis and what can be done to kind of look at what is happening, patterns and trajectories, and kind of address it in different ways and find new ways of addressing this. So the World Mosquito Program in South America, in Latin America, is growing the mosquitoes in labs, and they infect it with something called a Wolbachia. It's a bacteria, and and when the Aedes aegypti has the dengue virus and Wolbachia inside it, it is not able to transmit dengue anymore. So it sounds complicated, but when you visit it and when you read the story, you will kind of get a picture of how it's done. And what they do is they work with local authorities, they work with the public health systems there. And again, as Dr. Swaminathan mentioned and Dr. Dhimal mentioned, dengue is one of the fastest growing infectious diseases. So the use of such technologies or the use of such solutions becomes very important across countries. And one way to kind of, obviously it's all scary that dengue is spreading and malaria is spreading, but one way to also talk about these stories with our readers is to tell them that there are people working on this, and there are these, there are collaborations which focus on this, and we can figure it out. We can have this demand for better health because people care about their health. And if you tell them that there are these ways and these projects where people are doing things to make the world better, despite the challenges, then it can be an interesting read. It can also help in creating a dialogue with the communities. Because when I did this story and I spoke to the VCRC in India, the Vector Control Research, the research group responsible for it in India, they have been working on this for a long time now, but this has not been implemented in India for various reasons. And then the question comes, as journalists for me, is why haven't you done it when others have done it? And that in itself is interesting, because then you are asking the authorities, when you knew this was possible, when you knew we could control dengue, why didn't you do it? And obviously other questions have emerged based on that. Like there is various issues are there with this. But I think that it just opens up a lot of interesting ways to do stories when you look at the outbreaks and then you look at what others are doing to control it, and what we can do to kind of make the conversation a bit broader. Yeah.
Yeah, I quite agree. There is growing concern that journalism is bringing too much negativity in people's lives, especially with climate change. It's all gloom and doom. And if we have the time, Mahima, I'll return to you to talk to you about the fellowship you're currently pursuing at the Constructive Institute in Denmark. But I first want to go to Dr. Swaminathan, who said that she needs to drop off early. I wanted to get her thoughts on something that she spoke about, eco-anxiety. Dr. Swaminathan, in the West, young people now have a heightened awareness of climate change, which is producing eco-anxiety. Many of them don't want to have children. But in South Asia, our realities are different. If I may generalize, the struggle to survive is so acute that we really don't pay attention to mental health. But with all the climate impacts that we're seeing now, as you said, this is something we need to begin talking about. And, given our social realities, Where do you think the conversation should begin, and how can journalists contribute to it?
Thanks, Supriya. And I want to connect some of the dots, that have come up in the conversation that's happened so far. And we've had excellent inputs from the journalists. And I can really see how it is very challenging to do good stories and, to do the research and make it sort of based on facts and data. And also what you just said about the gloom and doom of climate reporting, and how do you keep the balance, so that you don't fuel further the anxiety that people are feeling. Now, I think this eco-anxiety phenomenon has been described amongst young people. And I was talking to a psychiatrist yesterday, Dr. Lakshmi Vijay Kumar, who runs Sneha, which is a suicide prevention NGO based out of Chennai. And she was saying that she's met young people. And a particular case that she described was from a girl from a well-off family in Chennai who lives very close to the sea, So, of course, Chennai is a coastal city. And she's done a project recently, a school project on climate change, and read all of these facts about sea level rise, that Chennai could be actually underwater by the year 2100, like many other coastal cities. And so she now has nightmares about her house actually going under the sea, at night, that her dog gets drowned and things like that, and sort of nightmares of this impacting her own life as she lives it today. The fact that she's not going to be able to live that life for much longer. So I think we probably don't have a full picture, an idea, and maybe underestimate the impacts on mental health on people, especially young children, adolescents, young people, of seeing all the time around them the news. On the one hand, of course, the conflicts that are raging around the world, but then the impacts of climate change on animal species, but also on humans. And so I think our schools really need to, education institutes, think about, firstly, yes, exposing children to the facts and the science behind what is actually happening. But also, I think, and for journalists as well, paying attention to some of the amazing stories of adaptation, of resilience, of community action, of people actually taking very bad things happening around them and trying to turn it around. So like I mentioned, we work with fishermen on the coast. They're actually a group of volunteers now that's going out to bring in the ghost gears to deal with marine pollution, because marine pollution is impacting their own livelihoods, the livelihoods of their community. So they have a vested interest in trying to improve things. Of course, we need the government as well as communities and businesses. Again, I bring on businesses because they can do a lot to help mitigate and also through their own policies and practices. Of course, they need to become more environmentally friendly and green, but they can also help communities around them and communities maybe even further away. For example, by recycling some of that marine waste, the ghost gear and the plastic that's coming out of the oceans, recycling it so that you get a circular economy, waste to wealth kind of. You need businesses actually that are investing in that. So those are kind of win-win things. Similarly, I think cities, I think really need to start looking at where are their hotspots where their citizens could be vulnerable. We spoke about some of them being more vulnerable to heat stress or to flooding than others. What can cities do actually to protect? And then I think we heard about how when you have this, I wanted to really congratulate the journalist who spoke about heat, because she raised some very important issues on how our policies are not nuanced and data driven as per the local. So same 35 degrees is very different when it's a dry and a humid environment. And therefore, the cutoffs for heat waves need to be based on local data. And the reactions and actions also need to be based on local. So I think that's a work in progress. We need more such attention to where the policy gaps are still there. and where we need action based on local data and more research as well. And I think Dr. Dhimal also made the point that this type of research that is locally relevant, contextual, that can impact local policies, I think that's what we need our South Asian researchers now to be working on. Plus, I think technology, we saw during COVID, the huge increase and outputs on R&D and innovation that were coming from around the world, including a lot of it happening in Asia and South Asia. So I think adaptation and mitigation of climate is, just like the pandemic, a massive crisis for humanity that's living here in this region. And we need to find local, affordable solutions. Like, for example, how does one deal with heat? If you're living in this place, what sort of robust and affordable solutions can we think of? And there's need for massive capacity building at all levels of the health system, but I think also across, employers, businesses, because I think we cannot have business as usual if you're going to be faced with climatic conditions which are harmful to human health. We will have to adapt the way we work, our working hours, and what you have to provide at workplaces, in education institutions, and in healthcare centers. There have been cases of newborns suffering heat because the maternity ward is, on the top floor of a hospital which is not air conditioned. So I think we need this lens now. Climate, we're not used to looking at things through this lens, and I think a lot of people are, not that they don't want to do something, but they're not even aware that these kind of things are happening, and there are these trade-offs. So having more journalists looking at this, but certainly we need more scientists, researchers, more policymakers, and it's all an interdisciplinary thing, right? So we need social scientists as well, anthropologists, and I think that's where the stories come in. You need the hard evidence and data and facts, but you also need the stories that make these things come alive, and I think that's what the media does for us.
Thank you, Dr. Swaminathan. I know you need to go. We, of course, have many more questions, but we'll keep that for another webinar. Yes, but
thank you very much.
Completely agree with you that we work in silos. Even in journalism, we kind of seem to have these compartments where you're a health journalist or you're an environment journalist. And sort of similar patterns prevail even in our governance structures, where there's the Ministry of Health and then the Ministry of Environment and Climate Change. So the future is going to be interdisciplinary. It has to be, because our problems are of that kind. I'll just return to something that we were talking about earlier, which is, solutions journalism. Mahima, you're at the Constructive Institute, where this is exactly what you're looking at. Share thoughts with us. What have you been talking about with the other fellows there?
Thank you, Supriya. So we are 5 fellows from 5 different continents, and we've been looking at constructive journalism and climate change. And the reason was, so for example, the most recent last year's EBU report mentions that there is news avoidance. As Dr. Swaminathan also mentioned, there is eco-anxiety. People are getting scared reading the news, and there is just too much gloom and doom, as you yourself mentioned. So what is it? So people are, if you don't have consumers of news, there's no point of us doing so much journalism around climate change. So one thing we've been hearing from experts over and over again is that we have a lot of good climate journalism, but we need to make it better. And one way to do it is to be constructive. So it's not just solutions journalism or painting a rosier picture of the solutions that we have, but actual critical investigative stories. But instead of just the 5 W's and 1 H, we end with a what now or what next. And so we kind of ask the key sources, policymakers, businesses, what are you doing to tackle this? Or what can we do to change this? So that kind of lays a path for more constructive elements to come in our reportage as to how can we make this better? How do we make sure that a city like Chennai does not end up flooding or get drowning because of sea level rise. That's also my hometown. So yeah, these are things we do live with. So yesterday, for example, I'll just take a minute more. We had Catherine Dunn of the Oxford Climate Journalism Network, and she said, there is, we have, when you do only gloom and doom news, people are left with nothing but guilt, shame, and fear. And from the history of looking at how cigarettes have been discouraged, or how people fat shame people into getting better or fit, it doesn't work. Guilt, shame, and fear doesn't work. So then she says that we need to acknowledge the complex reality of climate change for our readers. It's not that we paint just rosy pictures, but we also kind of then move forward and talk to other sectors, as you mentioned, like interdisciplinary, intersectoral responses about what we can do to make this better. So in health, especially, Susan mentioned this, you mentioned this, and Dr. Swaminathan mentioned this public health approach of looking at what the health systems are doing, looking at what our health departments are doing, as Tabassum said, what the local health departments are doing. That is very important, and that's where a lot of great climate stories can emerge, is what I'm realizing, where we kind of look at these localized stories, but also look at the systems in place to either tackle them, or what if they are, for example, are there enough epidemiologists in India? We don't know. So things like that. So that's what we are looking at, and yes.
Yeah, I mean, it's exactly our job as journalists to report the world in all its complexity, and you know even if you set out to do solutions journalism where you're looking at solutions, you may actually find that solutions can produce their own set of problems, which is actually what happened when Tabassum started looking at wind energy on the coast of Gujarat. Now, wind energy is a form of renewable energy, clean energy, and we need to be moving towards that. But she found that it's kind of leading to a peculiar health concern. Now, some very briefly, if you can tell everybody about what you found when you reported this story.
I'll quickly say how I sort of started working on this story. I was working on a completely different story in Gujarat when an activist told me that along the coastline there are villagers complaining of restlessness and anxiety. They're not. They have headaches, and I think windmills are responsible. And you should just visit and see how if there's a story there. And coincidentally, I just went and I realized that it's a huge story which nobody is really reporting upon. Basically, there are two things behind windmills that are causing a lot of concern amongst environmentalists. One is that of course, they are renewable form of energy, but they are made of non-biodegradable glass fiber, which means that once their shelf life is over, recycling them and degrading them is a big issue. So while they are saving, we're switching from fossil fuels to renewable energy, we're also actually creating garbage which is difficult to handle. Second, what I realized while talking to villagers was they could not sleep at night because the sound of the windmills close to their villages was actually keeping them awake. This was leading to irritability, constant headaches, dizziness during work, and a lot of them actually can't articulate what they're feeling. So if you talk to kids in school, they will tell you that we're not able to sleep and we're not able to concentrate on studies. If you talk to women, they'll tell you we keep having headaches and we keep going to doctors, but there's no solution. If you talk to men, they'll talk about agricultural problems that they're facing because of windmills in the local region, because it's affecting soil and the water table somehow. Everybody has different sets of problems which they are not able to articulate. So you actually also can't do a health story thinking that you go and talk to the people affected and then tell you, okay, this is the cause and this is the effect. That does not work like that. You have to talk to doctors and experts and basically draw a link where you are able to establish that a windmill is basically leading to these health complications in people. Because people living on the coastline these are the people who are mostly unskilled laborers who do not understand what is causing their health issues. And I thought this was a fascinating story because we just think that this is the solution, but it's also creating a new set of problems. So, yeah.
Thanks, Tabassum. We have now just a few minutes left, so we'll take a few audience questions. Dr. Dhimal, there's a question for you. One of our audience members has asked, You think the Melamachi disaster is a result of unchecked road construction, encroachment, as well as changing climate? If you could please take that question, but I would also fold in, another question for you, which is we've been talking about solutions journalism, but we also should talk about climate solutions. And do you think in South Asia that conversation has begun? And are you seeing signs of that?
Thank you, Supriya, for very nice two questions. Regarding the first part of this Melamchi disasters, yes, it is the result of both climatic and non-climatic factors, like the expansion of road in the hilly area, as well as mainly the climatic factors. That means heavy rainfalls, unexpected in the upstream, which resulted this Melamchi flood. And immediately we had another flood also in the mountain Kagbeni in the Mustang. So such type of unusual event, extreme event, has increased in the South Asia, not only in Nepal. Second, yes, we should talk about the solution now, not only the anxiety things. So for that, many South Asian country has already started mainstreaming the climate issue in the health policy and plans. Similarly, health aspect in all policies, because we need to advocate health in all policy and health for all. For example, before the conference of party in Copenhagen, in 2010, uh, the Maldives organized the cabinet meeting under the sea to draw the international attraction that small island country are at risk of the sea level rise, right? Then Nepal organized the cabinet meeting in the base camp of Mount Everest, Kalapathar, just to draw the international attention that okay, mountain are at the risk, we are at the risk of the glacial leak, outburst, flood, and others. So this is the way of political commitment to draw the international attention, right? Similarly, all the ministry of the WHO Southeast Asia has already started developing the climate resilient and low carbon health system, because we need to solve two issues together. One is the mitigation, next is the adaptation, because health sector itself is also emitter. Like almost 4.5% emission come from the health sector in each country at least. So many country has already started. So that means climate resilient health system is nothing. It's just the public health system which is built on the six building blocks of health system, like leadership and governance, financing, health workforce, financing, and medical products, etc. Right. So the country has already started at a good signal. And next is, usually health was in the annex of the conference of party in negotiation, but now it is mainstream, because all the UN body recognize that climate crisis is a health crisis, so health should be at the center of the negotiation and discussions. So that's the good things. And next, till last year there was less than 0.5% funding goes to the health sectors adaptation, but now many development partner has already committed 1 billion US dollar at least for the health and climate. So these are the good signal, and I think we need to go ahead with the positivism so that we can solve the issue. Thank you.
Thank you, Dr. Dhimal. I mean, in India, like I live in Delhi, where we have like the most toxic air, in the world. We're breathing it in day in and out, and most of us are falling ill. And yet, we're not really seeing, even at the level, like within India itself, governments of various states don't seem to be working together to come up with a solution. So as you said, like political will is part of it. The other part is are resources available, to put in place scientific systems, and there are many other aspects of that. But there is one question that comes up for us as journalists, and I'll go back to that. You did say that there are ways of tackling, the absence of data, but again, the fact that journalists have to be in dialogue with the scientific community, and I guess it has to be a two-way conversation. Is there anything as a scientist that you'd like to put word out there for journalists who sort of trying to report on this subject? How can they establish better communication with scientists? As a scientist who interacts with journalists, would you have any advice?
That's very interesting part. Actually, there is a big communications between scientists, policymakers, and journalists. And in my opinion, that should be in a triangle, all needed. Because if I sit with the policymaker directly as a scientist, I can't communicate exactly. Because my language will be more scientific, and policymaker or the public may not understand, right? But knowledge broker is the journalist, right? So my suggestion is that we should develop a partnership. For that we need to create a specific forums. There are already some forum like INSA and others, and if you can work in partnership, then collaborations, then I think that will innovate some ideas for solutions too. Because it's not a rocket science, right? We need to realize and we need to innovate, then only we can translate that evidence into practice. So for that, my suggestion is that not only scientists and, let's say, journalists, including policymaker, we need to develop a partnership through appropriate forum.
Thank you. There's one audience question that's come in that perhaps you could respond to. What do you think about many authorities using climate change as a way of not being accountable to basic public health needs, where everything can now be just justified as an outcome of climate change?
Yes, that's very important because we can't blame everything to climate change, but sometimes we our language is like that. So as a result, many people do not even believe one thing. Second thing, that was the main issue in the past, but now it is univocal that okay, climate change is real, right? Now for the impact means we need to explore, we need to give the local example. In the beginning, I share in the past, if we talk, nobody believe, but now it's a reality, witness, like the outbreak of the disease in the Himalaya mountain, right? So I think if we can work in a participatory approach, you know, taking the confidence of the people as well as taking their voice together, I think it's not big challenge for me. I'll say thank you.
Yeah. Thank you. There's one more audience question, and this is for the journalists. How can journalists effectively communicate these complex issues to the public in a way that promotes basic understanding and action? Mahima, would you like to take that question?
Um, well, that's the entirety of our journalism education, isn't it? Uh, but I think one of the things is, which we all do, is kind of imagine who's the least, like, how do you explain this story to a person who might like to your mom or your friend? And for example, the fishery stories I did with the Pulitzer Center was, and the morning context, it looked at where does your fish come from, who is the person going and fishing it, and how does it reach you. And then you kind of throw in climate change into it and various stages at which the fisherwoman and and even like the marine fishers experience climate change, how the ecosystem works in that because of heat, how the ecosystem suffers, and then because of that the fishers suffer, and because of that the fishes you get may be of a certain variety or not. So, and it also causes migration, and what does that do to the fisher's family? So kind of just going back to the basics and using storytelling to bring in the science of climate change into the story. Yeah.
Papri, I hope we have a better chance at being able to hear you. Any thoughts on this? How do you tackle, this challenge of communicating in a simple way without simplifying complex issues?
Is it clear?
Yes.
Yes. Okay. Uh, would you please repeat your question? My audio is
How, as a journalist, can we communicate complex issues to the public in a way that promotes understanding? How can we report in a simple way without simplifying complex issues?
okay. Actually, health issue is a complex issue, obviously, sometimes. So we should collaborate with the scientists, we should collaborate with the doctors, then we should write in a simple way. Actually, public does not understand the scientist text or language. But if I break it part to part, uh, it's the way to reach the people. Like my story, they know that they are damaging their reproductive health, but they actually nobody uh, as no journalist write about it, then they don't know about it. Now they all the women of coastal region, they know that using saline water is harmful for them.
Right. Yes, that's of course the important role that journalism plays in society. And I think at that note, we'll have to wrap this conversation. Thank you, all the panelists, Dr. Dhimal, uh, Mahima, Papri, Tabassum, and our audience. Thanks for patiently listening in, and I hope you found this useful. We've shared a couple of links, and I know that you're having trouble accessing them. We'll make sure that we email the link to you as well. And just a final word, to do this kind of work, journalists need the support of the readers and viewers. So please do contribute to newsrooms that are making an effort to report on complex stories. I work for Scroll. There's a link there. Please do consider becoming a Scroll member. And of course, Pulitzer Center as well. Please support Pulitzer Center, which is doing the crucial work of supporting this kind of reporting across the world. Thank you very much. On that note, goodbye, good evening.